You know the feeling. The paper bib is sort of clipped around your neck. You're staring up at those intense fluorescent ceiling tiles, and the dentist is just hovering right over you.
Yeah, totally. It's a lot.
Right. And then the jargon starts. They begin rattling off this rapid fire string of like numbers and clinical terminology to the dental assistant. And you're just sitting there totally wide-eyed, just nodding along.
Just trying to use your eyebrows to say, I totally understand what's going on.
Exactly. You're trying your absolute best to look like you get it, but internally. I mean, you have absolutely no idea what they're actually doing in there.
Well, yeah, and it is an incredibly vulnerable position to be in. I mean, your mouth is full of cotton rolls and suction tubes, so you can't exactly, pause the procedure to ask for a quick vocabulary lesson.
No, definitely not.
So most of us just sort of surrender to the process. We trust the word clean, and we just assume it means the exact same thing for everyone. But, and this is key, clinical language exists for a really specific reason. It defines very specific, distinct biological interventions.
Which is exactly why we are pulling all of this apart today. We're doing a deep dive into an essential guide provided by my gentle dentist, Arana. And our whole mission today is to completely demystify, exactly what happens during a professional dental clean.
Right, because their whole philosophy is about empowering the patient,
Yeah.
shifting you from someone who just has things happen to them into someone who actively understands the mechanics of their own healthcare.
Yeah, we want you to walk into that clinic knowing exactly what the roadmap looks like.
And, well, the most important fork in that roadmap is the realization that, frankly, not all dental cleanings are created equal. The dental field categorizes these treatments based on what is actively happening in the microenvironment of your mouth at that exact moment.
So to understand the really, heavy-duty interventions, we first need to establish what normal actually looks like.
Right.
Let's start above the surface. Before we even touch on disease or inflammation, we need to look at routine maintenance. The clinic categorizes this as a standard clean, but the official medical term here is prophylaxis.
Yeah, prophylaxis. And a critical distinction the clinic makes here is it's entirely geographical.
Geographical.
Yeah, so prophylaxis is strictly above the gumline maintenance. You have to think of the gumline as a biological border. And this specific procedure, it respects that border. It stays entirely within the visible territory of the tooth.
Okay, so when they're working in that visible territory, they're clearing away the daily buildup, right? Like the plaque, the tartar, and those everyday surface stains from the coffee and tea we all drink way too much of.
Exactly. And the cadence for this is usually, every 6 months for a generally healthy mouth. It's purely preventative.
Preventative, right.
Right, because the intent behind the action is really what matters here.
Yeah.
Prophylaxis is not a treatment for an active disease. It's literally just designed to preserve a healthy baseline.
Okay.
Because, honestly, we're constantly fighting a losing battle against the natural environment of the human mouth. I mean, even minutes after you brush your teeth, this thin film of proteins from your saliva, it's called the pellicle, it just coats the enamel.
Wait, the pellicle. So it happens that fast, like minutes?
Minutes, yeah. And then bacteria immediately start colonizing that film, which is what creates plaque.
Wow. It's fascinating when you look at it mechanically like that because, we always use that cliche idea of wiping down kitchen counters, but it's much more like the routine maintenance of a ship.
Oh, that's a good way to put it.
Right. The standard clean is like scraping the small barnacles off the hull of a boat just above the waterline. You do it regularly so the ship cuts through the water smoothly. But, and here's my question, if we're doing this at home with our toothbrushes every single day, why do we need the professional barnacle scraping every 6 months?
Well, because biology is just relentless. And frankly, your toothbrush has mechanical limitations. I mean, your brush is great at sweeping away soft, freshly laid plaque, but your saliva is packed with minerals.
Like calcium and stuff.
Exactly, calcium and phosphates. And its natural job is to remineralize your teeth and keeps them strong. But the unintended side effect of that is that it also calcifies the bacterial plaque that you missed with your brush.
Oh, no.
Yeah, it literally turns that soft film into a hardened, concrete-like structure. That's what we call calculus, or tartar.
And I'm guessing once it turns to concrete, the nylon bristles of my totally normal toothbrush aren't going to do a single thing.
They are completely useless against calculus. I mean, the structural integrity of the tartar is simply too strong. So the standard professional clean, the prophylaxis, that's the intervention required to physically break that calcified bond. It's just resetting the baseline. because your home tools simply don't have the mechanical power to do it.
Okay, that makes perfect sense for everything above the waterline, so to speak. But what happens when those barnacles start forming below the surface?
Right.
Because if the standard clean is just handling the visible tooth, we really have to look at the warning signs the clinic points out when things start to escalate. Like you might notice your gums feeling tender, maybe looking a bit swollen, or bleeding a little when you floss.
Yeah, and the cause there is that the plaque and tartar have actually migrated down beneath the gums.
Beneath the gums, right.
And this is where we basically cross the border from prevention into pathology. When tartar builds up below the gum line, it actively triggers the body's immune response.
Because it's foreign.
Exactly. The body recognizes this porous, bacteria-filled foreign object embedded right against its delicate tissue, and it basically just goes to war.
Okay, but let me just push back on this for a second on behalf of anyone listening right now, because I feel like this is where the frustration usually sets in for people.
Sure.
If I'm standing in my bathroom and I'm diligently brushing my teeth twice a day, maybe using mouthwash, how is plaque still managing to sneak below the gum line? Like, is this just an inevitable timer that goes off if you skip a dentist appointment, or are we just fundamentally failing at brushing our teeth?
Well, it totally feels like a failure of effort, right? But it's actually an anatomical limitation.
Anatomical.
Yeah, because the gum tissue doesn't actually attach to the tooth at the very top of the gum line. There's this tiny natural collar of tissue around the base of each tooth, and it creates a microscopic pocket.
Oh, I see. Like a tiny moat around a castle.
Exactly like a moat. And the bristles of a standard toothbrush, they simply cannot reach all the way down into the depths of that moat, no matter what angle you use.
So it's physically impossible.
Pretty much. So microscopic amounts of plaque just accumulate down there, totally out of reach, and then the saliva minerals calcify it into tartar. And once that tartar sets up shop down in the moat, the immune system detects it.
And I'm guessing the immune system's response is the inflammation we end up seeing in the mirror, the swelling and all that.
Yes, exactly. The body actually sends white blood cells, specifically neutrophils and macrophages, to the area to fight the bacteria.
Wow.
And to get those cells there quickly, the blood vessels have to dilate, which is exactly why the gums look red and, bleed so easily. But here is the really critical mechanical failure of the whole thing. As the tissue swells from all that inflammation, it physically pulls away from the tooth.
Oh, wow. So the moat actually gets wider and deeper.
Right. Yeah, the drawbridge is essentially pulled up. So what was a healthy, maybe 1 to 3 millimeter pocket, it expands into a 4, 5, or even 6 millimeter pocket.
That sounds bad.
It is, because the deeper the pocket gets, the more oxygen deprived it becomes down there. And that is the perfect breeding ground for even more aggressive anaerobic bacteria. So it just becomes this vicious, self-perpetuating cycle.
And because that entire cycle is happening below the border, below the gum line, the standard professional clean we talked about earlier, the prophylaxis, that's officially off the table.
Right. The preventative approach has officially failed at this point. I mean, a simple surface polish is definitely not going to stop an active deep tissue infection. So the clinic must shift to a therapeutic intervention to address the disease right where it lives.
Which brings us into the territory of what everyone calls the deep clean.
Yes.
And the official medical name for this procedure is scaling and root planing. And from what I understand, the geography is completely flipped now. We are operating entirely below the gum line, right?
Yes.
We're in the invisible zone, diving deep into those expanded pockets.
Yeah, they are literally crossing into the active combat zone at this point.
But wait, let's actually look at the mechanism here, because this sounded intense. The clinic notes that during root planing, the dentist actually smooths out the root of the tooth.
Right.
Hold on, smooth it out with what? Like, are they literally scraping the tooth structure away? Because I know enamel is strong, but the root of the tooth isn't covered in enamel, is it? Isn't there a huge risk of damaging the actual tooth?
That is a highly perceptive question, actually. And you're completely right. The root is not covered by that ultra-hard enamel that protects the crown of the tooth. It's actually covered by a much softer material called cementum.
Cementum, okay.
Yeah, and because cementum is so much more delicate, scaling and root planing requires, extreme precision. So dentists and hygienists use these specialized hand instruments called curettes, and they're actually curved to match the specific anatomy of each individual root. But they also use ultrasonic scalers.
Ultrasonic tools. Wait, so it's not just physical scraping?
No, it's a combination. So the ultrasonic scaler It vibrates at tens of thousands of cycles per second.
Oh, wow.
Right, and these micro vibrations just completely shatter the hardened calculus.
Right.
But honestly, even more fascinating is the physics of the water spray
Yeah.
that they use with these tools.
What's the water do? Just wash it away?
Well, yes, but because of the rapid vibration, it actually creates these microscopic vacuum bubbles in the water, and they implode violently. It's a process called cavitation.
Wait, so the bubbles are literally exploding or imploding?
Imploding, yeah. And those microscopic shock waves literally tear apart the cell walls of the bacteria hiding in the pocket.
Are you serious? So they're blasting the bacteria on a cellular level while simultaneously breaking off the hardened tartar.
Exactly.
That completely changes how I picture a deep clean. I thought it was just scraping.
It's way more high-tech than people realize.
That's wild. But let's go back to the smoothing the root part for a second. The goal of root planing is to basically create a glass-like surface on the cementum. And when I read that in the guide, honestly, the best analogy I could think of was woodworking.
Oh, how so?
Well, think about trying to glue two pieces of wood together, right? If the wood is rough and splintered and it's covered in, like, old paint and gunk, the glue is never going to hold.
Right.
The bond will just fail almost immediately. But if you take some sandpaper and you do the hard, meticulous work of sanding that wood down until it is perfectly smooth and perfectly clean, the glue adheres flawlessly. It creates the seamless structural bond. So it seems like root planing is essentially preparing the surface so the gums can literally glue themselves back onto the tooth.
That analogy hits the biological mechanism perfectly.
Yeah.
Seriously. Because the calculus that builds up on the root, it's incredibly porous and rough, so it acts as this permanent irritant, just mechanically chafing the delicate inner lining of the gum tissue with literally every bite you take.
Ugh, that sounds awful when you put it like that.
It is. So by systematically removing every microscopic rough patch and all the bacterial toxins embedded in that cementum, you eliminate the physical irritant entirely.
Which I assume stops the immune system from completely freaking out.
Exactly. The immune response dials back, the inflammation subsides, the swelling finally goes down, and the tissue stops bleeding. But the absolute most remarkable part of this is the reattachment.
Right, the gluing.
Yeah. Your body contains these specialized cells called fibroblasts, and once they sense a clean, biologically compatible surface on the root of the tooth, these fibroblasts just kick into gear and begin synthesizing new collagen fibers.
Oh, wow.
They actively reach out and reestablish the periodontal ligament, physically binding the gum tissue right back to the tooth structure.
I mean, it's just astonishing because we tend to view our teeth as these static, lifeless blocks of bone in our mouths, you know? But there is this incredibly dynamic, living construction project happening down there at the cellular level.
It really is a marvel.
It's like the human body is capable of literally sewing itself back together, provided we just clear the debris out of the way first.
Which really highlights the clinic-specific phrasing, right?
Yeah.
They refer to the deep clean as a highly effective therapeutic treatment. It's not just a cleaning. It is a targeted medical intervention meant to reverse structural damage, eliminate an active infection, and fully restore biological integrity.
Yeah.
It operates in a completely different paradigm than just the standard surface polish.
So we have this very stark, very mechanical difference between the above the gumline prevention and the below the gumline therapy. But I guess the obvious question for the person listening right now is, how do you actually know which one you need?
Right, and that is the practical application of all this knowledge. I mean, you understand the mechanisms now, but you can't exactly apply them to your own mouth without real data.
And this is where the philosophy of my gentle dentist Arana Hills actually provides a lot of relief. Because you shouldn't be standing in front of your bathroom mirror, pulling your lip down and trying to play dentist based on a little bit of redness.
No, absolutely not.
Like, you don't need to try and guess if the plaque has breached the moat and expanded the pocket. You just leave it to the pros.
Exactly, because attempting to self-diagnose periodontal issues visually is basically impossible. The real damage is occurring completely below the tissue line. So the clinic's philosophy really emphasizes that a professional checkup is the only way to accurately assess your gum health.
Okay, so what do they actually do to check it?
Well, they use a small, specialized ruler. It's called a periodontal probe. And they use it to physically measure the depth of that exact moat around each and every tooth.
Ah, so they get the actual millimeter data. They literally map out the pockets.
They map the entire topography of your gum line. And that clinical assessment just removes the burden of guesswork entirely. Like, If pockets are tight and shallow, great. You stay on the preventative path with a standard prophylaxis clean.
Right.
But if the measurements show that the drawbridge is pulled away and those pockets have deepened into the disease zone, well, then they pivot to the therapeutic scaling and root planing.
Honestly, it makes the whole experience so much less intimidating. When you understand the actual logic behind the tools they're using, the dental visit transforms completely.
It really does.
It's no longer this mysterious, anxiety-inducing event where you're just subjected to random scraping and prodding. You are walking in with a conceptual map of your own biology.
And when you remove the mystery, you remove a significant portion of the fear. You really become an active participant in the preservation of your own health.
Absolutely. So let's just summarize the core takeaways here, because navigating this jargon really is the key to that empowerment. If you remember one guiding principle from this deep dive today, let it be the geographic rule.
Yes, geography is everything here.
Exactly. Your standard clean the prophylaxis is your above the gum line preventative hero. It's the routine maintenance, the barnacle scraping that just keeps a healthy mouth healthy.
And if the defense line happens to be breached, the deep, clean scaling and root planing is your below-the-gum-line therapeutic intervention. It is the absolute precision smoothing required to stop that inflammatory cycle and just allow the tissue to actually heal.
Two completely distinct tools for two totally different biological states.
Spot on.
Well, before we finish up, there is one final thought I want to leave you with, and it's something that kind of goes beyond just dental hygiene. Just think about the sheer resilience of your own biology for a second. We spend so much time worrying about how fragile our health can feel, right? But your body is constantly primed for repair.
Always.
Just sit with the fact that by simply smoothing out the microscopic surface of a tooth's root, just removing the structural obstacles, your body instantly takes over.
It doesn't need to be forced to heal. It really just needs the opportunity.
It just needs a clean slate. The moment that surface is prepped, your cells are actively seeking out the tooth, synthesizing collagen, and rebuilding the physical bonds from the inside out. I mean, it is a profound level of bodily autonomy and regeneration happening quite literally right under your nose.
That's a great way to think about it.
So the next time you are lying back in that incredibly comfortable yet somehow highly intimidating dentist's chair and the fluorescent lights are humming above you, you won't just be listening to the jargon fly right over your head. You will know exactly what is happening, why it's happening, and precisely how your body is going to respond.